What is the single best peptide for weight loss? What is the single best medication for weight loss? Are we talking about the same thing? Retatrutide is a peptide being studied and researched for FDA launch in 2026 by Eli Lilly. Why all the buzz about Retatrutide? Well, because it works on 3 different receptors at the same time. So it works on the GLP-1 receptor, which we know suppresses appetite, helps increase the release of insulin, lowers blood sugars, and helps get rid of that food noise. It's also a GIP receptor blocker, which also can enhance insulin release and may have an effect on fat metabolism. It also works on the glucagon receptor, which also may be helpful in fat metabolism. That's why in clinical studies going on right now, it has dramatic weight loss, what we call bariatric surgery type of weight loss, more than the other GLP-1 receptors, semaglutide and tirzepatide. But at this point, it's still experimental, pending FDA approval. Now, it hasn't been studied for the cardiac benefits you can certainly get from semaglutide, which has been shown and studied. Retatrutide is a peptide, but it is being studied by Eli Lilly to be a pharmaceutical coming out in 2026. Many people are starting Retatrutide now. How? Either by being in a clinical trial, which is very few people. Most people are getting it from a compounded pharmacy where they sell you peptides. Now, with any peptide you get, it depends on where you get the quality product from. Quality assurance, so if it says a milligram, it has a milligram, not 0 milligrams, not 2 milligrams. Sterility. It's made in a sterile process and it's made to be an injectable. Most peptide pharmacies or compounding pharmacies that sell peptides, it says experimental, not for human use. And that's because it isn't indicated for that. If you're interested in peptides, I would suggest going to a healthcare provider who's an expert on it to guide you through it. Why is it so important to see a healthcare provider? Because the medical weight loss should be medically supervised. Healthcare providers also want to make sure that your weight loss is controlled and steady. In general, 1 to 2% of your body weight per week. This ensures that you're losing mostly fat, maybe some water, but preserving muscle. So having a high protein intake, doing resistant exercises to make sure you don't lose that muscle mass. Retatrutide, it's an experimental medication being sold as a peptide by pharmacies. Is there enough information for you to start using it? Or will you wait for the FDA approval sometime in 2026?